All right, mate. All right, I know you're mad. I know. Digby at home is an absolute softie. He is sweet, he's affectionate, and he loves a cuddle. But take him out anywhere to meet any other dog or anybody else but the immediate family, and that 50 kilograms of love turns into 50 kilograms of raw aggression. Whoa. It's okay. All right, settle down. I'm not doing anything. I'm not going anywhere.
Dig.
A lot of people would say straight away, that's an aggressive dog, it should be put down. And I understand that. Just stand up with him for a second, Amy. Sharon made one of the cardinal mistakes when buying a puppy. She didn't meet the parents. She bought a cute, fluffy puppy, thinking she was buying a beautiful, new, friendly member to their family, but that's certainly not what she got. Oh, he's a good chap. Yeah, I'm just gonna sit down. Sharon, do you want to try and sit down as well?
Yeah.
Let's all just have a love-in, shall we?
Yeah.
Let's just see what's going to happen.
See, you silly thing, aren't
Let's
you,
see what's
eh?
going to happen.
Not gonna hurt you.
Look at Mummy giving you a lovely snuggle there. There we go. I'm just going to try and just give him a little tickle. Okay. All right, I know. It's a little forward, wasn't it, mate?
Come here.
It's a little forward. Sorry about that. This job sometimes throws curveballs, and aggressive dogs come in, aggressive cats come in, and you've got to treat them, you've got to deal with them, so you've got to find a way to make it work. All right.
We always make sure for him we put a muzzle on and he's safe when he goes out. It's just being responsible, really.
All right.
Silly, come on.
I'm just going to take a bit longer. I'm trying to rush this relationship, which is never a good idea, is it? Okay.
Because when we take him out, you get people that stare and they do make some nasty comments. Why don't you put that dog down? It makes me angry. No, we never ever put him down. We love him to bits.
So, Amy, tell me about the lump. Like, when did you first find it?
I think it was about 3 or 4 months ago.
Yeah.
Ever since I've been trying to find a vet.
What I'd love to do is to try and let him see if he'll let me feel his chest. Oh, give you a bit of a tickle there, hey? Hey? Oh. Okay. All right, I know. I'm not trying to win the argument straight away. I know. I'm sorry. The whole time he's lunging at me, I'm just telling myself, be calm, don't react, don't move, stay still. Oh. All right. Am I scared? Are you kidding? I'm bricking it. 50 kilograms of raw muscle power coming at you with bared teeth and growling. Okay. And every instinct is saying, keep your distance. But then I look at Sharon and Amy and I see their faces just literally saying, please help us. You are our last chance.
It's a shame he's like this, really, because I see a lot of Rottweilers.
But you know what I can see with him is I can really see that he is actually a sweetheart. I can see that. I really can, Digby. You're trying to be aggro, but I can see you're sweet and lovely, really, aren't you? And look what you're letting me do.
I mean, the good thing with Scott was that he did remain calm and he didn't have eye contact and he did manage to stroke Digby, which no stranger has ever done. I couldn't believe it, really.
I'm just using some acupuncture points as well. There's one on the tip of his ears that just chills him out a little bit. Oh, I feel very honoured. I must say that when I was finally able to touch Digby for the first time, it was exhilarating. I mean, it was like touching a wild animal. And to give him a little scratch under the chin, honestly, it gave me goosebumps. It was amazing. What a handsome big pussycat. Eh? Big 50 kilogram big teeth pussycat. Yeah. It was lovely having the love-in with Digby, but it was always going to end. And it was going to end in the form of a sharp needle in his butt. Do you want to put him into this corner maybe and then he can't push back? And that was never going to bring out his happy side. I went from hero to zero, but sadly it needed to be done to knock him out, but he wasn't impressed. Done. I know, yeah, he's mad. All right, I'm definitely a swear word that I can't say, aren't I, mate? I always recruit Nath. When it comes to the tough cases, I always give him a call. But in this case, quite frankly, it's about heavy lifting and he's got the muscles for it. So yeah, Nathan gets the call. Nice little slumbering Digby. So this is Nathan. He's gonna help me knock him out. He's pretty reactive, as you can see. He's had enough to knock out a rhino, and yet he's still moving, but here we go. impressive, mate. I'll give you that, honestly. So we'll have to use a little bit of force in order to place the IV. Once we've got the IV in, we're all good. We're just going to be covering up his face. Just in the dark is where we want him to be. He'll stay calmer when he's in the dark. Good boy. It's all right. Nice sleepy time now.
Digby!
Come on, buddy. The first time I saw Sharon and Amy, they were just introducing me to Digby and showing me the lump on his chest. Now, after a while, that lump has got bigger. So today is all about getting to grips with the lump and actually just removing it. Normally, there'd be a whole bunch of steps and examinations that we do prior to this kind of surgery. That's just not an option with Digby. So what I need to do today is knock him out. I need to remove the lump and hopefully send them home with good news. All this activity will actually make him go down in a second. He's more likely to crash and sleep. Now he's energised himself, blood supply is flowing, those drugs will kick in a little more. So after 2 injections of sedation, which would have been enough to knock out a rhino, he finally is calm enough that I can get an IV anaesthetic into him. 1, 2, 3. Now we've got to get him down the stairs, and I'm walking down thinking this better not be cancer. Not only because it's dreadful news for any owner, but from Digby's point of view, how the hell am I ever going to treat this dog if it is cancer? So fingers crossed it comes out as something not to worry about.
Oh yeah, I can feel it now, yeah. It's quite a decent size.
Yeah, it's a big one and getting bigger. Okay. So let's see what this nasty little thing has in store for us. So now I'm just going underneath. Just see what I find. It's not looking too bad to me. If I cut through the middle. Nath, that looks a hell of a lot like fat. Nice, healthy, white, glistening fat. So that means there's almost certainly to be a lipoma. Nothing to worry about, which is great news for Digby. Mate, you don't need any more vets, do you? No. Straight away, I think Sharon and Amy are going to be over the moon. They're going to be so happy. I mean, this is their boy, this is their love. And the fact that this is one surgery that we can perform, we can fix the problem straight away, and he potentially doesn't need to come back and see me, is good news. Okay. Good boy, that's it. All done. It was a fantastic day for everyone. This is a definite win, this one. Digby is a dog that's got lots of problems. We didn't need to add to them, and today, hopefully, I've removed some of the problems from that family. Right, he woke up very quickly, and I'm gonna exit. Good boy. Hi, guys.
Hi, Scott.
So, you look very expectant and very worried, but in fact, it's all good news. It looks like a fatty growth, which is called lipoma, which is really good news. I should be seeing smiles. Should be seeing smiles.
Good.
You happy?
Yeah, it's good news.
It is good news, isn't it?
I'm glad.
It's nothing to worry about. I've put sutures that don't need to be removed, so literally it's a case of taking him home and hopefully living a happy and healthy life.
I'm glad. I was worried here. I thought it would be something more serious.
Yeah. But I can see he's definitely got a kind heart in there. He's just quite misunderstood. He's a lovely dog.
He's fantastic at home. I'm good about him.
But I'm just really glad that I've been able to hand back your beloved dog with my 2 hands intact. That's quite nice.
That's a plus side.
And without a lump on his chest.
Yeah.
It means a lot, what you've done. There's no other vet that would actually see him.
Yeah, that's very kind. Thanks very much.
I wouldn't, you're perfect. You're a perfect vet.
Yeah, you are. You are.
around him, and
That's
he
so
knows
sweet.
that. So.
Oh, thanks. Well, that honestly means
No,
I got choked up a bit there. Lovely. I mean, I don't think I'm anything special. I'm literally just a vet doing his job, but I'm glad that she was happy. All right, so he's just through here. Aren't you, mate? Hello.
Digby, baby. Digby, sweetheart.
Okay, ladies, he does still seem quite sleepy.
Yeah.
So, what I'm going to do is I'm going to jump in there and I'm just going to jab him again in the bum, just as he enjoyed that the first time. I'm sure he's going to enjoy it again. Sharon, if you stand up, Amy, if you then go in front of me, not that I'm throwing you the lions or anything, but you can just go beside his shoulders and just give him a cuddle, hide me from you and him. There you go. So if you just crouch down with him, that's it.
Good boy.
I think many people might find the fact that I treated Digby controversial. People might say that I shouldn't have given him any treatment at all. He's aggressive and he should have been put down. Come on, mate, time to go home.
Come on, dear, come on.
Well, I would say to those people that he is a much loved member of Sharon's family. They adore him, but they know that he's got problems and they've put steps in place to ensure that he's safe and everyone else around him is safe also. So I would say to them, I'll look after Digby and you look after your own dog. All right, ladies, it's been a pleasure. Bye, mate. Be a good boy.
All right.
Come on then, let's go. Here we go.
Thanks very much, Scott.
My pleasure. You guys look after yourselves.
Thank
See you, buddy.
You got him?
Come on in, honey.
See you, mate. Yeah.
Thanks a lot.
Thank
Bye-bye.
you.
Bye.
Bye.
All the best. Bye, diggers.
Oh, come on, come on.
Oh, man.
Good boy.
That'll take it out of the vet, that will.
Oh, good boy. Good boy. Come on. Good boy. Good morning.
Hello, good morning.
How are you?
I'm fine, and you?
Very well. Hi, Harry. How's
Well,
he
you've
doing?
seen Harry for a few times now, and
We have.
there's quite a lot going on with him still, so I'm hoping today we'll
Get
get
to
a
the
little bit
bottom
more
to it.
sorted out, yeah.
Fantastic.
Yeah.
All right, Harry. Scott will be out with you shortly. Just have a seat for
Thank
us.
you very
Okay.
much. Thank you. 5 weeks or so ago, Harry swallowed a piece of string, a small piece of string, which got stuck in his gut somewhere, and fur got pushed around it and it blocked up his passage. Anyway, they sorted that out, but the stress apparently caused his bladder to bleed, and he couldn't pee.
Hi, Roger.
Oh, hello, Scott.
Good to see you again.
Nice to see you.
Back
Hi.
again.
Yeah,
Hey.
yeah.
Hello, Harry. Hello, champ. All right, come on in. Let's have a chat. Come on, in you come.
Come on then. It's very painful, actually. It's very distressing to see him when he's uncomfortable, because he's usually a very laid-back cat, and obviously you don't like to see him when it hurts, yeah.
He's a very friendly boy, but I think he's quite sick of us as vets, isn't he?
Well, he's not really sick of you, but he'd rather not come here all the time if that's possible, but
Yes.
he's been in and out quite a lot.
So over the last few weeks, since the urinary output's been a problem, his
Yeah.
ability to go to the toilet, tell me a
Yeah.
little bit about how that's playing out.
Well, he is fine and nice little cat for many hours of the day, but then for a couple of hours every so often he really has a lot of problems. He's trying to pee, he's growling and uncomfortable, and he's obviously in pain. So hopefully, this can be sorted in some way.
Yeah, okay. Well, look, before we start talking about what the next steps might be, I just want to have a little feel of his bladder.
Okay.
Good boy. All right. So tender. Oh, you're sore, aren't you,
Yeah.
mate? Just literally barely touching it. Oh, and it started to growl already. Poor Harry has had a terrible time of late. He's got something called FLUTD, which is feline lower urinary tract disease. It's caused by loads of different things, but in his case, it's stress, which has led to bleeding of the bladder lining, which has then blocked his ability to pass urine. So he's had some really tough times. Oh, sweetheart. Dear, you can tell when a cat's in lots of discomfort when they change personality like that.
Yeah.
I mean, you are such a sweetheart, but that hurts, doesn't it? So the problem with your chap is his little chap. Basically, it's the bone in his penis that is the issue. What we need is flexibility of that tube to allow for the cells that are being produced by the irritated, stressed bladder to be able to come out. And they're not able to at the moment. And the concern with that is that when a cat can't urinate regularly, it can irreparably damage their kidneys.
Yes, yeah.
that backflow pressure of the urine from the bladder and then back to the kidneys can cause major damage, and worst case scenario, they can get renal failure and die. What I need to do to your boy is to actually remove his penis.
Yes, yes. Well, if that's going to make him better, but what would the result be?
Well, ostensibly, this is a sex change operation.
Yes, yeah.
So he has his penis removed, and then the urethra is then folded outwards to become basically a vagina.
Yes.
But by doing so, it should have a larger opening, and then the cells that have been clogging up at the base of his penis will now be able to be passed more easily,
yeah.
and the threat of kidney damage would have waned.
Yes, yes.
We'd much rather Harry be healthy without his penis than with it and
Yes, quite, yeah.
unwell.
Well, if that's the solution and we've tried everything else, that's the only thing to go ahead with, so that's what we'll do.
Unfortunately, we are at the point where this is the last thing we can offer, and we don't want his kidneys to start being damaged, so unfortunately, I'm going to have to prioritise your kidneys over your willy. Sorry, mate. It needs to be done. All right, gents, well, you guys better say goodbye to each other.
Okay. Bye-bye, Harry.
Come on, Jack.
See you later.
Here we go. All right then, Roger.
Okay.
Take care.
Bye.
We'll see you on the other side.
Okay.
All right.
Say bye, Daddy. It's all right, I know. You love your daddy, don't you? You do.
Hey, guys.
Hi. Hey, Harry.
Harry's back again.
Hey, buddy. What's that face for?
Well, today, Harry's going to have his penis taken off.
Right. Okay.
Yeah.
So we're gonna go to sleep as Harry and wake up as...
Harriet, I suppose. Yeah.
Don't listen.
Oh, poor boy.
Don't listen.
Unfortunately, buddy, less than 1% of cats that have this condition need this very nasty surgery. Okay? It's got to be done, I'm afraid. The main issue is that his urethra, the tube from the bladder to the outside, is spasming. It's tightening up, which means that he can't pass urine normally. So unfortunately, what we need to do is something akin to a sex change operation and increase the diameter of the urethra to allow him to urinate normally.
Good boy, good boy. Oh, what a noise.
Sleepy time now. The issue here is that if his urine continues to get blocked, the kidneys can be irreparably damaged, and that can lead to kidney failure, and Harry could pass away from that.
It feels a bit rude having to do this. I feel a bit intrusive.
Well, it's very intrusive. I can't think of anything more intrusive. We have to deal with uncomfortable things as vets all the time. For Harry to live comfortably, he needs to live without his penis. And as much as that's horrific to consider, it is what we need to do. Okay, everyone ready? Harry's happy?
Yeah.
Okay.
Wow, that's quite incredible.
So it's a complex procedure. There's lots of nerves around the site, and you can get lots of complications after the procedure if you don't do it properly. So at this point, I feel confident, but still a little nervous. A few butterflies. I'm at the point now where I have got his sort of internal willy external. Okay, so now the suturing begins. It's just so fine, so delicate, and you know, one little mistake, 1 millimeter one way to the other can be a real issue for the cat. And now I have to say goodbye to his willy. I need to cut it off. Sorry, mate. Yeah. to know for sure that the hole I've created is a decent size. Thankfully, the catheter that I can place is about 3 times the size of the original lumen, the diameter of the urethra, which shows that 3 times as much volume of urine can pass comfortably without issue. So hopefully that is going to mean that Harry's much more comfortable in future. I'm really happy with the result. So it just means now that he shouldn't have to strain anymore. He should be able to urinate comfortably. So yeah, I'm happy. Let's wake this chap up, or cat up.
He's still a boy.
He's still a boy. So Harry will be staying here at the practice for the next few days, being loved by all the nurses and making sure that he's able to urinate comfortably and that the suture line is kept healthy with that collar on, because I know that Harry's going to want to get hold of it. All right, buddy, okay, be a good boy, okay? No licking. No licking that spot, no looking. It's probably for the best. Good boy.
Hello, Kirsty.
How are you?
I'm fine. How are you?
Good, thanks. Come to pick up Harry.
Yes, yes. We're looking forward to seeing him again.
Oh, I bet. Should I have a seat? Scott will be with you in a moment.
Thank you.
Hello, mate.
Hello, handsome boy. How are you? You're so much happier now, aren't you? You are.
I'm really happy with the results. I'm relieved that it's over. I'm relieved that Harry has woken up perfectly well. And the next few days will show us just how well he's able to use his new, well, equipment. Come on. Oh, big handsome boy. Come on, you big brute. Let's go. Good boy. That's it. Good boy. Where is he? Where is he? There he is.
Oh.
Hey.
Hello.
There you go.
Hey. It's good to see you.
Hey.
How are you?
Yeah, he's looking at the door, so.
Oh, he wants to go, I can tell, yeah.
Hey. He's doing so fantastically well, Roger.
Oh,
I mean,
good.
Literally the day after the surgery, he's now able to urinate a full bladder of urine.
Great, great.
He's no longer uncomfortable when I feel his tummy.
Yeah.
He's eating well. He's just doing brilliantly well.
Great.
Harry has been such a fantastic patient. He's responded beautifully. He's completely comfortable. He's just a very, very happy cat. He's just doing all the right
And
things.
he's desperate to go home and we're desperate to have him there. So
I'm
aren't we?
sure.
Yes.
I'm sure you are.
Yeah.
Roger is such a gent. He is such an old school man, but you can tell he loves this cat and he's just so happy to have Harry back in his arms. It's great to see them both back together again. You take care and keep a close eye on that back end for me.
I will.
Make sure he's winging for England. All right? All the
Thanks
best.
again. Okay, all the very best.
Bye, buddy. All right, we'll see you soon.
Thanks a lot.
Okay, bye now.
Bye-bye now. See you
Bye,
soon.
chaps.
Bye. Bye.
Bye. Hello, Roger.
Oh, hello, Scott. How are you?
Great to see you.
It's good to see you.
I've come to see your lad.
Great. And he's waiting to see you. Come
Cool.
on in.
Thank you.
Okay. But here he is. As you can see, is the picture of health.
He is. Hi, mate.
There.
Gee whiz, you look very handsome. Healthy and handsome, don't you, hey? Hello, buddy. All right, well, let's have a cuddle with Dad and go and have a quick look at you, shall we? Oh, you are a lump, aren't you, hey? Come on, then.
Come on, Harry.
It's a bit of a nervous day coming to see Harry today because although a required procedure, it's not a nice one, and any bloke watching this would go, ouch. So I'm just hoping that Harry doesn't hold it against me. Well, he seems very happy and healthy. How's he been since
He's been very well. He's been very well. He came home, he immediately started eating well. He's back to his normal self and even better in a way, yeah.
Yeah, and the urination, that's the key thing we were trying to fix, is allow him to urinate more calmly and simply and easily.
Yes.
Is that the case?
Absolutely, absolutely. Right. He's doing very well in that way.
Yeah. I mean, the key to success is actually having him urinating less often with larger volumes.
And that's exactly what's happening.
That's absolutely perfect.
Yeah, he's a very happy lad. He's completely over it and jumping around all over the place, back to his old self again.
Oh, what's that for? Okay, well, I suppose that's fair enough, isn't it? Yeah? Is that fair enough? You're getting one back on the vet. I did remove your penis, so I think that's probably fair.
Where are you going? Where are you going?
Right at the end, Harry, fair enough, wants the vet to just get off, and he takes a little chunk out of me, which is fair enough, after I took a chunk away from him. But he certainly seems incredibly content and happy.
Oh, yeah.
Hopefully going to live a long and healthy life now.
Yeah, I mean, he's only still a young cat, really, or middle-aged, I suppose, in cat years, and looks as if he's going to be all right now. It was touch and go. I think we did worry a lot about him, but I think he's fine now. He's still got his old spirit about him, yeah.
Hi, Marie. How are you?
Oh, I'm at my wit's end, honestly.
Okay, what's going on with Banu?
Banu is in season and she's driving me crazy. She's been slightly amorous with my husband, Tim.
What's she doing?
She's rubbing her bottom all over him. And then, just to get him in the mood, she nibbles his ear.
I feel like I've walked in on a bit of a girly chat here.
We're just talking about my amorous cat.
Oh, right. Like you do. Hello. Okay, come on in, Marie. Banu is an incredible looking cat. She's a Sphinx cat, which naturally have no hair. They've got big eyes. They look a little bit like aliens. And she is really quite unhappy.
It is hilarious as she tries to mount my husband.
Wow.
Nibble on his ears.
Oh, she's trying to nibble on me as we speak.
And, you know, she does favour, apart from you, unfortunately, she does favour the males at this time of the month.
Okay, and when you say favour, what are we talking?
Rubbing her bottom on him
Right.
and nibbling his ears.
Wow, it's quite intimate, isn't it?
It is.
Well, let's get you out and have a little look at you.
No, you're fine.
Hey, shall we pour you out? Hey, because you're a very emotional little lady at the moment, aren't you? There you go. Oh, wow. She is an amazing looking cat, isn't she?
Banu is a really affectionate cat. She's so loving most of the time.
Let's have a look at you. Okay. I know. Oh, dear. You are really in a mood today, aren't you? Dear me.
I think Scott's a bit scared. I'm not gonna lie.
Oof. Hey? I love you, but I hate you.
I think he's slightly petrified of Banu.
When they can't enact their natural behaviours, they're going to get frustrated.
Yeah. All right, baby.
I don't know whether she's in pain or not. I don't really understand it. But basically, what we have to do is we have to lock her in the bathroom with our litter, our cat food, and our bed, and it's the only place that she'll calm down.
First of all, I need to get to grips with Banu, if she'll let me, and that's just doing a full physical examination, just understanding how healthy she is. Is there any reason why we can't go forward with surgery? Because, of course, we need an anaesthetic in order to spay her.
All right, sweetheart.
Normally, when listening to animals' hearts, what we can hear in a healthy animal is lub-dub, lub-dub, lub-dub. In the case of Banu, what I can hear is a small flutter, a little tiny sound, and that is not normal. It looks like her hormonal endeavours are going to have to continue for a little while because I can hear a heart murmur, which would suggest that part of her heart is abnormal.
Oh.
Heart murmurs really aren't very common in cats. It's like a ticking time bomb. One day they can be fine, and the next day they can be near death.
Oh.
But what also is a concern here is that, of course, to spay her, we need to give her an anaesthetic. And an anaesthetic in a cat with a heart murmur is very risky indeed. It increases the risk dramatically.
Okay.
So, unfortunately for now, you and your husband have to deal with that moody behaviour for a little longer.
Oh. So what are the next steps for checking this out?
What we'll have to do is refer you to the Royal Veterinary College, and that's a place where they can do a scan of her heart and then find out exactly what abnormalities, if any, are present.
Right, okay.
If they find at the Royal Veterinary College that she has an abnormality in the heart that's significant, then surgery may be the only option to allow Banu to live a normal, healthy life. So Marie has got a very difficult and tricky time ahead of her.
I'm pretty upset considering that Banu can actually die from this. I came in laughing this morning and now I'm leaving really, really worried.
Oh,
Oh, it's okay, Banu. We're gonna get you sorted, okay? Yeah. Let's go. Come on. Oh, it's okay.
Hello, you right?
Yes, Marie.
I'm Ilaria, nice to meet you. Who we have here today?
This is Banu.
Hello,
We've come to get her
Banu.
heart checked today.
Oh, cool. Hello, you. How are you doing? So we are ready to go.
Great,
Please
thank
come
you.
follow me. There we go.
If Banu can't get spayed, it's going to be really stressful for the family and for Banu. But our main priority just now is the heart murmur and making sure that she's okay. Oh, I love you. I know. It's all very scary, isn't it? Banu is a big part of our family. Everybody adores her and loves her. So to think there might be something seriously wrong with her is really scary.
Okay, Banu, are you ready? Good girl. Some cats have murmurs that are not related to any disease, and some other cats, unfortunately, have a murmur, and that may impact their life expectancy and long-term prognosis. Oh, no. We're sorry.
I feel really nervous. I've got butterflies, and I think that's just not knowing what Ilaria's going to tell me about Banu's condition.
Okay. Doing very well.
It's all right, it's all right.
It's okay. No, we accept that. You've been really brave.
Clever lady.
There we go. Hello, Marie. Claudia. Here we go. Baby. Mommy's here. What we found during the scan is that she's got a little hole in her heart.
Okay.
But the hole was sealed. So we went hunting for other causes of the murmur, and we couldn't find any other. So the good news is that her murmur is not associated with any disease, so she doesn't need, any
Surgery.
treatment. She can go ahead with surgery. She can be spayed. There is no evidence of any abnormalities, and that is really good news. She's got normal life expectancy, no problems at all. We consider her heart to be normal.
I'm so relieved that her heart is fine because we love her so much. I just can't imagine anything bad happening to her. And now we can get her spayed, which is amazing. Oh, thank you so much. Thank you. I'll give you lots of cuddles tonight. Oh, brilliant. Oh. This is the best news that I've had all week. We've been so worried, and it's such a relief, and I just feel less stressed already. Come on, let's get you home. Get you lots of treats.
Hey, Marie, how are you? First of all, great news.
Thank you
Amazing.
so much. I'm so happy. I'm so relieved.
You must be
honestly.
so relieved. I mean, it is fantastic news because when you have a cat with a heart murmur, either it can be horrendous with a really big chance that they won't live a full natural life, to what is completely an innocent murmur, so not going to have any impact on her life at all.
No, just fantastic. It was the best news. Wasn't expecting it. Was expecting the worst. So I'm just relieved.
Yeah, absolutely. Well, we're not completely out of the woods because obviously today we are going to have to spay her and try and reduce her sex pestering ways.
We're just hoping from the operation that she can be her usual happy self that she is 9 times out of 10.
Come on. Wow.
Beautiful jump.
Well, we're coming into colder times now. Yes, Mummy needs to get a matching one.
Banu comes out of the cage and is wearing a lovely knit jumper, of which Marie is very proud of. Knit jumpers on a Sphinx cat, okay. Are we being serious with this? I mean, Banu, you look ridiculous.
What's wrong? She looks gorgeous.
Ooh, wow, she is loving me today. It was because I mentioned your fashion. You never comment on a lady's clothing.
Never diss a woman's fashion.
All fashion jokes aside, it is a serious day for this little lady. Now we just need to get you through this and hopefully you'll be a bit less cantankerous. Could you try? No. That's the answer. A resolute no.
No.
All right, do you want to say goodbye to Mummy?
Oh, bye-bye. Oh, I know. I love you.
Banu is part of our family. She's like our fourth child. Everybody just adores her and loves her.
I'll see you after. Be good. Well,
Okay.
bye.
Bye, I'll see you later. Bye.
Bye, see you, Marie.
So obviously we're going to be worried about her today going under anaesthetic, but I know that she's in really, really good hands with Scott.
Come on then, Chuckles. Hi, Jess.
Hello. Oh, my goodness. Hello.
Yeah, very, very happy customer. I'm just hopeful that because you don't look dissimilar to her mum, that she might like you a little bit more than she likes me.
Hey, it's okay. Hey, Banu. Oh, sweetie. All right.
Wowza. Right, so... hello, mate. Because she is so mad and so stressed, rather than trying to give her an injection, I think it's best we just give her some gas, calm her down nicely, and then we can move forward with the spay. All right, so we're ready?
Well done.
Good girl. Oh,
All right.
no. Good girl. Even though we have proven that her heart is okay, I still think she is a patient that we want to watch very closely.
Oh, well, that's better.
That's the one. Okay, so she can just flop over there, Jess. She's not breathing right now. Sometimes they just go down quite deeply, and although the anaesthetic was given very, very gently, Banu has stopped breathing, and it's an emergency situation right there. She's not breathing right now, so we just need to encourage her to do so. Good girl. Come on, take a breath.
Is that her?
Is that her?
Yeah. There and again. Yay, good girl.
Okay. Yet again, Banu, you are trouble. Yeah, that's much better. So Banu decided that she wasn't going to breathe for a little bit longer than is comfortable. So I think she just wanted me to sweat a bit. So.
Did you?
Oh, yeah. Yeah. You know there's problems when Jess and I aren't saying anything.
When it's gone quiet, that's
When it's got quiet, then you know there's something. Yeah. Okay. I wonder if it's because I was mean to her about a jumper.
I was going to say, do you want to keep that on and we just tuck it up?
Just as long as you breathe, I don't care what you wear. Just, there we go. Breathing is good. Jumper optional. I'm just scrubbing my hands to get nice and clean before the surgery, and then I'm going to be performing a spay, which is basically removing the ovary and the womb from Banu. Once the surgery's done, the likelihood is that Banu will just calm down. She won't have those hormonal highs and lows. She'll be hopefully the nice, serene Sphinx cat that she could be. So this should be quite a quick procedure, but I think just for everyone's sake, if you can listen to her heart quite intently, that would be good.
Everyone else at rest. All good up this end, Scott? Yep, happy.
Okay, so just about to cut. So although this is a fairly routine procedure, I think for this cat, it's going to make a huge difference to her quality of life. This is a very hormonal, very stressed lady, and removing the factory for the hormones, the ovaries, is going to make all the difference in her life. There's one ovary there, and you can see it's very active, and that this cat is a very hormonal girl right now. I have to be careful what I say. I'm surrounded by women, so I can't say anything bad. Yeah. Jess, we're all done. She can wake up.
Lovely.
All right. Don't know if she'll like me anymore before or after the surgery. It's so hard to tell.
We'll see.
I'm really happy that Banu has come through the anaesthetic. Initially a little bit of a scare for us, but she's come through perfectly fine and she's going to recover from this and hopefully enjoy a hormone-free life.
Hi, Jess.
Hi there, you all right?
Yeah, good, thank you. How's Banu been?
She's been good, very well. If you want to take a seat, Scott will see you shortly.
Perfect, thank you. I'm really excited to get her back and give her some cuddles and give her some TLC and know that she's okay.
Right, let's see how much happier you are after that spay. Ooh, maybe not so much. Hey. Come on. Oh, Banu, goodness. Wow. What was all that about? I must say, I'm a little shocked at how Banu has behaved towards me. I'm hoping it's just hormones. And that given a few weeks, once they've calmed down, I can go and see her at home and she'll give me a cuddle. Fingers crossed. Hi, Marie. Here's your little treasure.
Oh, hello, baby. What have they been doing? I know you're going to be so angry with me.
Do you want to come and see Mommy?
Yeah, I think so.
Oh, I know.
Is wholeheartedly unimpressed
I know.
with me.
Oh, I know. It's okay.
It feels really good to get Banu back. I've been worried all day about her, and just to see that she's okay is brilliant.
Well, thank you so much for looking after her.
It's been a pleasure. Or has it been? It's certainly not been a pleasure for her, I can tell you that much.
Hopefully you'll meet her when she's a bit nicer. No frowning. Too young for Botox. Keep your face calm. Yeah, you're a good girl. See how happy she is, Jude?
Yeah. Good girl, Banu.
We are so happy to have Banu home. Her recovery has been fantastic, and she's calmer already. I know Scott said it would be a few weeks, but there's definitely a difference in her behaviour already.
Hey, Marie, how are you?
Hello, Scott. Good. How are you?
Really well,
Nice
thanks.
to see you. Want to come
Trust
in?
you, well, I'll see. How do you feel things have gone? Do you feel like it's made a big difference?
It's made a really big difference. Already she's calmer. It's like she's happier. Like we've released her from the burden
Of hormones.
And she's like, I'm so much better.
And now the big test is to see if actually she is a bit more, well, nice to me. Can I sort of stroke you a little bit? Banu is reacting the way Banu does. She hates me. Oh, yeah, pound of flesh and all that. Oh. I think she really is unimpressed about my presence in her house and in her life generally, but I'm really happy to report that it seems like her life has got much better in the presence of Marie and the family. Oh, hello. Oh, well, that's an improvement. And you're going to launch. Oh, wow. I feel honoured.
Oh, that was progress.
That was progress, yeah.
That was big progress.
Yeah, I could touch her without her savaging me.
Go see Scott. Get your leg fixed. I go and see Scott because I trust Scott. I've moved away from Richmond and I still go and see Scott with Mabel.
Hello.
Hiya.
How are
Yes. I know, don't be scared.
you?
of it.
Gorgeous.
Yeah.
Mabel is such a gorgeous dog, and Ali, she's just one of my absolute favourites.
Hello, gorgeous girl. How are you? Are you all right?
Hot and bothered, I think.
What's happening?
What can you see?
Oh, she's walking quite weirdly, isn't
And
she?
she won't weight bear on the rear right.
Ali's already been through the works with Mabel at very early stages in their relationship together. Just give her a walk and let's see what we've got.
Come on, sweets.
poor Mabel has got quite a severe lameness on her right leg, which is quite weird because it was her left leg that had surgery done on its back last year.
So she's a bit marionette, I think. She's a little bit wobbly, but...
I think wobbly is an understatement.
She struggles to get out of bed, and that's really sad to see. You feel awful, don't you? Because you don't want anything you love to be in pain. Slow down. Slow down. It just doesn't seem fair. She loves to play. All she wants to do is play. So when you stop her doing that, of course you feel mean. I feel terrible.
Ready?
Go. Go on, Mabes. I've taken her to see Scott and we've tried the softly approach. We've tried the kind of non-intrusive approach. The back leg, it's just not getting any better. If anything, it's getting worse. Good. I know, it's not fair. I know. I need to find out exactly what the problem is. I dread most of all if it's spinal.
Well, I think what's probably best is that we take you downstairs. You know you get VIP treatment. All right, well, let's get cracking. Come on, Mabel.
Come on then.
Good girl.
Sweet.
Hey, let's attempt some stairs.
Yeah,
eh?
that's always a
That's
laugh.
going to be fun.
I know. Come on, I know.
Can you manage? Oh, good girl. That's it. Well done. Nice and slow and steady. She's stepping really slowly and she's looking more like an arthritic 15-year-old dog than a youngster. We're going to do a quick neuro exam and just have a look and see what's going on.
Do you want me to do anything?
Just sit there and talk to her because I'm going to be doing some pretty weird things to her. Up we go. So that's Hammy's standing. So that's quite good. It shows at least that she knows her leg is there.
Okay.
Now let's see if she can move it like this. Yeah, that's where you struggle, isn't it, sweetie? So very, very weak on that side. Nice, strong patellar reflex. That's quite good. If that wasn't present, that would suggest that there was issues maybe in the lumbar, the lower lumbar part of the spine, but...
So that's good news.
That's pretty strong there, yeah. That's good. I know. Sorry about that. It's weird. I'm hitting you with scissors. I know. I'm just going to have a feel of this knee now.
Anything? Oh, she doesn't like it, though.
You don't like that, though, do you, baby? So there's definitely a little bit of discomfort here. She's not impressed about me playing with that. It's not brilliant that there's movement in this right knee, and what that suggests is that either she's strained her cruciate ligament, which could lead to instability in this leg, or she's actually ruptured it. The cruciate ligament is a really important, very solid ligament that runs from the top of the leg to the bottom through the knee, and it gives the knee stability. In sports people, like netball players or football players that turn very quickly, that's when they can rupture and tear this ligament. All right, baby girl. All right, sweetie. There's some nice happy drugs for you, hey? Given a history, I just want to take some x-rays to look at the bigger picture to make sure there's nothing else going on. 1, 2, 3. Good girl. This is troubling times for both of us. I can't hide it. She sees it. But the great thing about Ellie is she's pragmatic. She doesn't want to put her head in the sand. She wants to know what's wrong with her dog and what she can do to fix it. And for that, I absolutely love her. So what I'm going to do is lift her up and you're going to slide that underneath her bum.
Okay.
Ready? Count of 3.
Do my best.
1, 2, 3. There you go. Lovely. Good job. Great. That's beautiful. That's great. Okay. Nice. Just need to be in the room this time to take these x-rays, so this one, it's a very fetching outfit,
Yeah,
Ellie.
nice.
Yeah, what do you think?
It's longer at the front than the back. It's protecting your essentials, I guess.
Yeah. Not that I need protecting anymore. I'm definitely not having any kids, more kids.
Oh, yeah.
No way.
You said that last time.
No. I'm deliberately trying to keep the mood light because I know Ellie well enough to know that she'll be absolutely terrified of what might be wrong with Mabel. She's thinking of all the worst possible scenarios. Well, let's hope that these x-rays will give us some simple answers and we can get this beautiful but problematic dog sorted out. This is the old surgery. It's healed in that this is now attached to the bones. What we didn't have was a fracture in the patella. So the kneecap has got a fracture in it just there, which wasn't there before. That would hurt, and yet that is the leg that she is putting all of her weight on. because the other one has more problems than that. It just gives you an idea of how bad the other leg is, if that's the leg she's relying on.
Can it be fixed, that, or will it just heal?
It will heal given time. There is already a level of callus formation present there.
So it's been broken a while?
It's been broken a while, yeah.
Should I have noticed that?
I don't think so, no. How would you have? Because she's been flattering the other leg in the wind. There's absolutely no way that Ali, one of the most dedicated owners I know, could have picked up on the fact that her dog had a fractured kneecap. She couldn't have, because the dog literally is putting all her weight on that leg. And so, of course, anyone would focus on the leg she's dangling to her side, the right leg. It's fine, it's fine, it's honestly, it's fine. Don't worry, it's fine, it's fine. We'll get on top of this, we will, I promise.
So to see that and think, even a tiny fracture's gotta hurt, hasn't it? So, not enough to not put the weight on, I guess, but I still feel sad that she's in any pain at all.
That's not even the bad knee. I don't know why you're crying about that one, that's a good knee.
I should have known.
Oh, you couldn't possibly, you don't have X-ray vision, do you? The right leg actually doesn't look too bad. Mabel's right knee is showing no signs of major bony damage, which is great. So I'm still leaning towards some kind of cruciate ligament damage, but what I want to do is refer Mabel to my good mate, orthopedic surgeon Michael Hamilton, just to cast his learned eye over her and make sure. If it is a cruciate ligament, we can get it fixed straight away and finally give Ali some peace of mind. Fingers crossed.
God, I wanted us to have fun, but now I just want her out of pain. God, get a grip, woman.
It's all right.
No, it's not. I'm fine.
Ali's as tough as they come. She's as tough as old boots, but she loves her dogs and they're her life. And the fact that Mabel is suffering, she's heartbroken.
I know, baby girl. Can't sleep forever.
Come on, sweetheart. Ready? Here we go. I'm very hopeful Michael will find a solution. He's the expert, I'm not. Scott's recommended him. So, yeah, I'm really hopeful that after today, I'll know where we're going.
Okay. Good morning, Ali.
Hi, Michael.
It's lovely to meet you.
Hello. Nice to meet you.
So this is Mabel. Hello, darling. So, I've heard lots about you. Oh, she's gorgeous, isn't she?
I don't care if Mabel's wonky or limpy or a little bit odd, as long as she's out of pain. And I know she's in pain, so we need to fix it.
Should we go in then? Let's have a look. Go on.
Come on, sweet.
Go on, darling, let's have a look. So as Mabel walks in, clearly there's an issue with this back right leg. She's got a very kind of straight ankle, which is not normal. I have some thoughts about these ankle joints. So this would be what is our heel bone.
Yeah, this is where we thought the problem was.
This bit here, that would be our heel bone.
Yeah.
You and I walk on the flats of our feet, like this. Dogs walk up on their toes. She's very, very, I mean, look, this is a good leg. She's very, very straight on this leg. This conformation, this very straight-legged conformation,
won't have
potentially, yes, won't have helped. Now then, I have some news for you. She's ruptured her cruciate ligament. Yeah. Now, I'm going to show you a little test here. So I'm going to put my finger on the front of her shin.
Yeah.
I'm going to hold her knee still and pull up her toes.
Yeah.
And that, the way it pulls on the muscles, it kind of mimics weight bearing on her knee. Okay. This finger should not move. And that finger
is moving
forwards quite significantly.
Is it sore?
Is it sore? It's probably uncomfortable at best. It's painful in people, for sure. We see this very commonly in young, large breed dogs. But we can fix these very successfully. We're going to do a procedure called a TPLO, and that stands for tibial plateau leveling osteotomy. It's a very complicated sounding thing, and the analogy that I tell all these owners is, if you stand on an icy hill, you skid down the hill, and that's what Mabel's knee is doing at the minute. The bones are skidding around like this, and when we're finished, the bone is flat, and there's no hill, and the knee is stable, and the prognosis is excellent. It's really good, and we do hundreds of these, and they usually go back to normal function. She doesn't have much luck, does she?
No.
Yeah.
She hasn't had a lot of luck from the beginning. Really sweet. Till he found me. Hey.
I think we get her in today, we sort the cruciate out, then we see where we're at and we'll take it from there. Mabel has got a good attitude. I think she's going to be using that leg straight away. The problem that Ali might have is trying to keep her quiet, which in many ways is a nice problem to have. I'm going to take your pooch off you and stabilise her knee. Don't worry, she's going to be fine.
She'll be good for you, I know she will.
Oh, she's lovely, yeah.
She's no trouble.
No, she's lovely.
She's a sweet dog and she handles it with grace, really. So I owe it to her to just try and keep her fixed.
Right, Mabel, let's do it. You follow me, darling. Let's go this way. I'll see you tomorrow, Ali.
All right, then. Thanks.
Take care. There we go.
Oh, good girl.
She's a good dog. We've got the pre-med drawn up and stuff.
Yeah.
Sleepy boys. This is where you tell them to count backwards from 10. Count backwards from 10. And you're asleep. So the first part of the surgery is we're going to go into the knee joints to check this little thing called the meniscus, which is a little shock absorber inside the knee joint. So we've got to check that because if she's got a torn meniscus and we leave it alone, she's going to stay sore. Okay, so off we go. Huge, big torn meniscus, look at that. A torn meniscus is really, really painful. People describe that as a really, really sharp pain in the middle of your knee when you try and stand on your leg. So this should be a lovely, shiny, quite robust piece of white, shiny cartilage, but it's been flipped forward and it's been crushed by the bottom of the femur. That is a painful thing. So 90 degrees from the long axis for you, Ollie? Looks good to me.
Yeah.
What we're going to do now is the nuts and bolts of the procedure. We're going to actually make the top of the tibia, which at the moment is on a slope like this, we're going to make a cut in the bone and we're going to move it such that it's flat and we're going to stabilise it in that new position with a plate and screws. So last screw. Okay, so plates on, looks good, leg looks nice and straight. Just check his alignment, looks nice and straight. Happy with the plate position. Most importantly, have we done what we're supposed to achieve? There's no movement there now. That is a nice, stable knee. So we're going to close him up, and then we're done. Do you know what? I love this operation. They come in, and they're really, really sore, and literally within no time at all, they're not. Love it. It's quite a bold statement to tell owners, I expect your dog to make a full recovery, because not all of them make a full recovery, but the vast majority of them do. And that's what I'm expecting with Mabel. Okay. I might just get in here with her, I think. There we go. Okay, get well soon, darling. Right, okay. Oh.
Your mum's here soon. Where is she?
Hi, Ali. How you doing?
I'm all right. How is she?
Okay. She's all right, she's all right. Yeah, come on through, come on through. She'll be pleased to see you. She'll be pleased to see you.
Hello, darling.
There she is.
Hello. Hello, monkey face.
She's been great. She's been really good. Wish they were all like that.
Is she in a happy place?
She's in a very happy place. Oh, is it?
Yes.
It went really, really well. Her cruciate was completely ruptured. Her meniscus, the shock absorber thing, was badly damaged as well. No surprise. So that's been taken out. The knee is now stable. She's already putting a little tiny bit of weight through the leg, which is what we would expect with this op. So, yep, there you go. There's a lead.
Okay.
Pop that on her.
Brilliant. Thank you.
It's my pleasure. It's my pleasure.
Thanks. Michael's done a great job, as I expected him to do. I mean, he was recommended. He's a northerner. He gave me straight from him. So, yeah, how can I not trust another northerner in the south of England?
She's under the influence, so I hope she's not driving.
Come on, then.
So, right, off we go.
Come on.
It's a lovely feeling when we see the owners reunited with their pets, particularly when we've done a procedure where the prognosis is so good. Come on, darling, up you get. 1, 2, 3.
No messing about.
Come on, 1, 2, 3. 1, 2, 3. Oh, up you go.
Girl.
Nice and slowly, and you'll see her getting better every day. And if she doesn't, let me know. Mabel came in, harder using that leg and quite painful. And, you know, give it a few weeks' time, she's just going to go from strength to strength.
Come on, that's it, good girl. This way, to the car. That's it, good girl. I can't wait to get her home. She'll relax a lot more when she's there. All her beds are waiting, her tea's cooking. We just need to get her home where she's loved. What a good girl. Slowly, sweets. The last week's been noticeable in her spirit. She's been shoving toys at us and desperately keen to play. Good girl. Yeah, I'm glad I did it. It had to be done. But what I am glad about is how well she seems to have recovered. Mentally, she's ready to go. Physically, you know, the surgeon's really pleased with the results at 6 weeks. So, I mean, I couldn't be any more pleased.
Yeah, she's looking great, isn't she?
Isn't she?
Wow, she's walking really pretty well. I mean, 2 good amounts of weight on both legs.
She's using it all the time.
And do you feel that's getting better and better each day?
Oh, definitely.
It's always an absolute treat to see my mate Ali outside of the practice, but even better to see beautiful Mabel. And the fact that she is walking so well and looking so happy and so comfortable, as close to a normal dog that Mabel will ever get, is great news.
To other people, she'll look like she's got a limp or she's not right, but to me, I know that's as good as it ever was.
Yeah, and it can still get better.
Yes.
Great.
All the arduous tasks of lead walking only and building up the time and everything, it's paid off. Hopefully in another 6 weeks, she'll be off the lead and it'll all be a distant memory.
Come on.
That's it.
Hey, you can walk now.
I love her to pieces. I think she's got a face that only a mum can love. She's not, you know, loads of people think she's ugly. I think she's beautiful. She doesn't have a bad bone in her. I know she's not human, but she's my little baby girl.
Come on, Mabel.
Come on.
Come on. That's it.
Get a wriggle on. That's it.